So say you're a nurse in the hospital and you have a mother who's trying to breastfeed and it's taking a lot of your time, and you have other patients. What resources are available? Question 3. Are there educational resources that the nurse can reference or study or read through to prepare to help patients with breastfeeding? And the professional term for breastfeeding education is lactation management. So what are these resources that you could access? I'm just going to go over a few resources for professions, and maybe you can find more resources. So I look forward to finding out what you find out. But I'm just going to go over a few that I find very helpful. Ruth Lawrence's book, Breastfeeding: A Guide for the Medical Profession, is very detailed and will give you a lot of technical and scientific information on breastfeeding, and that is like a great reference book. The Womanly Art of Breastfeeding goes through, it's the Leche League Bible, and it goes through the series First Attachments, lactation management, nutrition and weaning. It goes through their categories of things, and it has stories from women that of overcoming difficulties, all those different things. So that's kind of a feel good, and it's written in a way that's very affirming and encouraging for women. And then I put the breastfeeding peer counselor information in the link here. And that's from the state of California. And again, that's a program that's offered nationally. But the state of California breastfeeding peer counselor information on the web is amazing. It's very detailed. It goes week by week, and it's really good. And then there's also the Surgeon General's call to action for nurses and healthcare professions, and that link is at the end of the reference section where you can find that. Question 4. What resources are available in the community that the nurse can refer Erica to for lactation support after discharge? This is really important, especially if no one in their family or their social group breastfeeds, or if they need encouragement. And you will find that the people, when they get together in a lactation support group, they tend to stay together as friends for a long time. My best friend is a woman, we were friends in La Leche Lake. So you'll find that this is the community support and the social support for the breastfeeding family is really crucial for their successful continuing of breastfeeding. So here's a big list of all the community support systems that are available. There's the local community breastfeeding support group. You can just look up breastfeeding and your zip code, and that's how it works with Breastfeeding LA. You just type in your zip code and it'll give you the group in your area. And then some hospitals have breastfeeding support groups where people who just delivered will come back after a week or two, and they'll have a little breastfeeding support group with their breastfeeding educator or their lactation consultant. And then the breastfeeding peer counselor, they follow up at the health department, and they have little breastfeeding support classes there. And La Leche League, and they also, you can look them up on the internet, and they're all over the place. And I bet you could find an additional breastfeeding support group in your area. And you'll find that even in the NICU, when the NICU babies, they're told to breastfeed and pump their breasts and get it all ready for their baby, and breast milk's important. And then when they go home, there's not that continuation of a community support or social support system. And so they stop breastfeeding and just go directly to formula. So it's very important for them to continue successfully for breastfeeding, to be able to link in with a social support group in their community.
Erica becomes short of breath with mild exertion and presents to the emergency room. The nurse asks her about her symptoms and asks her to take a seat in the waiting room. Erica's baby Corbin begins to cry. Erica is asking the nurse if they have a place for her to breastfeed her baby.
Based on what we've talked about so far and what we've learned, can you think about how the nurse should respond? What resources could they access? And what are Erica's options? The nurse has many options to take care of Erica and her baby. They can put Erica in a treatment room if there's one available. She can feed her baby in the waiting room if she's comfortable, but it looks like she would like to use a designated breastfeeding area. It looks to me like that's what Erica's asking for. Question 2. What evidence-based research supports the nurse's response? What have you learned from this presentation? How should the nurse respond? Who could they ask for help? What are the options you might think about? There are so many benefits for health for the mother and the baby that the Surgeon General, the Academy of Pediatrics, the World Health Organization, and many other institutions support the health benefits of breastfeeding. So if all these people and all the evidence supports the benefits of breastfeeding, the nurse should support Erica's choice of breastfeeding. Of course, she needs to have her heart condition checked, and that needs to be stabilized, but everyone should support a mother's right to breastfeed. And all these agencies have evidence to support breastfeeding. And I put the little links on there, and you might be able to find some other organizations and supportive agencies. Have you heard of any laws that protect a breastfeeding mother's rights? Have you heard of anyone who asked for their rights or asked if they could breastfeed and asked for the designated area? What are the legal implications for women who choose to breastfeed? A nursing mother has the right to breastfeed her baby in any location where the mother and baby are authorized to be present. There are state and federal laws supporting mothers who breastfeed. There's mandated rest times where they should be allowed extra time for their breaks so they can pump their breasts if they have to, or feed their babies. I know of a woman in the military who had a job. She fixes airplanes, and now she was given a desk job, so she is able to take her extra breaks that are mandated by law to breastfeed her baby and pump her breasts. And then also, if there's not sufficient breastfeeding accommodation by the workplace, there is a fine that the health departments are authorized to enact. Here's scenario 4, planning. Erica and her physician decide that when the baby's 7 months old, she'll have the surgical repair of her heart. She pumps her breasts after feeding her baby Corbin, so she'll have extra milk available for her baby if it's needed during and after her surgery. Can you think of any benefits of stored breast milk? Breast milk is the best food for the baby. The ingredients are easily digestible. Breast milk is easily digestible. It provides the first immunization for the GI tract. It helps protect the GI tract. It has the first immunization for the baby. It's not replicable by formula. And so that's why it's the best food for her baby. And it also, the milk of the mother changes as the baby's needs change. The first milk is colostrum, and that has special ingredients that help the baby. And then as the baby grows and the mother's milk changes, it comes into the mature milk. And then they'll actually, when they pump the breast, the mothers will notice that it changes as, during the time of day. It's different in the morning than it is in the afternoon. And then there's the first milk that comes out is a little thinner, and then there's the hind milk, which is a little thicker. So it's actually the perfect food for baby. What community resources might be available to support Erica as she thinks about surgery, storing her breast milk, pumping her breasts? Well, we've already talked about the breastfeeding consultants and educators and the Leche League and breastfeeding peer counselors and Breastfeed LA. And all of those resources can give Erica suggestions on how to store her milk and what's the best way to store her milk and how to get a good supply of milk. And also Medi-Cal offers free breast pumps prescriptions for those who qualify. And then I'm up in San Jose, and we have the Mother's Milk Bank. So there's some women who donate their milk, and they process it kind of like a blood bank. And then they use it in the NICUs for the small babies.